Welcome to Health or Consequences, the monthly healthcare podcast hosted by Commonwealth Beacon. My name is Paul Hattis from the Lown Institute. I'm here as always with my colleague and co-host, John McDonough from the T.H. Chan Harvard School of Public Health. And today we're thrilled to be joined by Matt Selig, who's Executive Director of Health Law Advocates, a public interest law firm devoted to healthcare and public health issues that you'll hear more about. And we're delighted to talk to Matt and run this in the week in which their organization has this incredible annual breakfast that they do that welcomes a good number of folks to come and join with them to learn more about them and support their efforts. So welcome, Matt.
Thank you very much, Paul and John. I'm a regular listener of your show, and I'm really happy to be on. And thank you for the plug for our annual benefit, which is coming up on Thursday, the 20th. And folks can go on our website, healthlawadvocates.org, and buy a ticket and join us or make a donation if they'd like to support our work for the year ahead. Thank you so much.
So this is John. Welcome, Matt. Nice to be with you. I was Executive Director of Healthcare for All for about 5 years, and Health Law Advocates was started by Healthcare for All as its nonprofit law firm, and that relationship still exists. Can you tell us a little bit about Health Law Advocates? How did it get started, and what do you all do?
Absolutely. So I'll start with Health Law Advocates, or HLA, as we're known. And the first three things that people should know about us are we're a nonprofit law firm. We focus exclusively on helping Massachusetts residents access healthcare, and all of the legal services we provide are free of charge. So let me build on that. So not only do we focus exclusively on improving healthcare access for all low-income residents of our state, but there are particular groups that are most at risk of lacking access to healthcare, of course, because of a disability, their age, gender, their immigration status, race, ethnicity, or even the language that they speak. So we make sure to especially focus on access to care for them. And I want to emphasize, we serve people statewide throughout Massachusetts. And as I said, all of our legal services are free of charge, but clients have to meet our income, have to be income eligible for our services. And a little bit about our history, how we came to be, as you started to say, John. So this is our 30th anniversary. We got started in 1995. And the founding story is that a brilliant and entrepreneurial lawyer and advocate known to many named Steve Rosenfeld signed up as a volunteer with Healthcare for All, which is, as you said, another healthcare advocacy organization many of your listeners are familiar with. And of course, John, as you said, where you later were the executive director. And Steve volunteered to take calls on Healthcare for All's helpline, which helps callers enroll in health insurance and provides information about accessing healthcare generally. And while Steve was taking those calls as a volunteer, a lot of people were calling about problems accessing healthcare, but they were actually legal issues because the client's rights were being violated. But there was a gap because there was no place that he could really refer them to for legal representation because most of the callers couldn't afford an attorney. So some of the callers could be referred to legal aid groups in existence at the time, like Greater Boston Legal Services, which helps people with public benefits. But there was no place to refer most of the callers. For some of them, it was because they were very low income, but made just a little too much to be eligible for Greater Boston Legal Services and other legal aid groups. For others, their healthcare access problem wasn't something that other legal aid organizations handled, like problems with commercial insurance, which is the kind of insurance most people have, including people with low income, medical debt, the impact of hospital closures on people, and other issues. So to fill this gap, Steve started a legal assistance project within Healthcare for All. And he did it in collaboration with the legendary Rob Rastusha, who was the executive director at the time. And it really took off because it was addressing a real need, filling a real gap. And pretty soon, HLA spun off and we became a separate 501c3 nonprofit. So that's the backstory of how HLA got started.
Tell us about you, though, Matt. How did you get connected in the role that you've been doing?
Sure. So I joined HLA in 2005. So I've been here for 20 years now. I began as a staff attorney representing clients with all sorts of problems, just as our lawyers do now, accessing healthcare. So coverage terminations, insurance denials, medical debt, kids in the juvenile justice system because they couldn't access mental health care. And we had 6 staff members at the time when I joined HLA way back then. Few years later, I became the deputy director and then executive director in 2010. And we now have 42 fantastic staff members, including 25 lawyers. And before joining HLA, a long time ago, I worked as a legislative aide for about 6 years in the Massachusetts State House. And before law school, I worked for about 2.5 years in Washington, D.C. for Senator Ted Kennedy on the Senate committee that he chaired that handled most of the health policy in the U.S. Senate. So I've been involved in health policy and law for most of the past 30 years, which is an alarming number, but it's been fun and very rewarding.
Matt, let me turn to operations today with that 42 staff member group, of which 25 are attorneys. I still imagine you could be overwhelmed with people calling you up for assistance. So, how do you, as an organization, decide who you actually take on as a client?
So, great question. So, we have 3 main criteria for deciding whether we can represent someone who contacts us for help. And we get thousands of calls and emails a year. So, the first criteria is, does the person live in Massachusetts? We only serve people in Massachusetts. The second criteria, do they meet our income guidelines? And
which are what? Roughly? Can you say a word about
sure,
that?
yeah, absolutely. So our income guidelines go up to 3 times the federal poverty level, which this year I have it jotted down. It's $46,950 for a single person, about $96,000 for a household of 4. And then the third criteria after residence and income is, do they have a legal issue that we can help them with?
Okay.
And our terrific paralegal team screens everybody for those issues, those criteria, including the type of healthcare access problem they're calling about. And our main practice areas are as follows. So, health insurance issues, such as problems qualifying to enroll in any kind of health insurance or getting a health plan to cover a specific service. Another really broad focus area for us is access to mental health care for young people up to age 22. And that work includes representing families on issues relating to schools and special education, also health insurance, getting services through state agencies, and even advocacy in the juvenile justice system, where way too many kids with untreated mental illness end up. Another broad area is helping people with medical debt. We represent hundreds of people each year who are victims of wrongful billing and collection activities, and some who just owe way more than they can afford and need some legal guidance on what to do about it. We're also interested in helping people with discrimination in the healthcare system based on factors like race, ethnicity, gender identity, or even the language someone speaks. And we're also open-minded. We are open-minded and will look at different healthcare access issues that people bring to our attention that might not fall in one of those broader categories. And then I also want to mention there's some areas that we definitely do not work on. We don't have expertise in, and those areas include medical malpractice, matters that are purely about Medicare. So that's a pretty broad area we do not cover. And we also do not work on guardianships. Occasionally, some people will call us on that subject matter as well.
Any quick story that you want to share of a recent client in one of those areas that you guys have taken on?
Yeah, absolutely. I'd love to tell you about a couple of our clients. So we represent about 1,500 people a year, first of all. So we're very, very busy. We have a lot of client stories. Many of them are success stories, thank goodness. Our team does a great job. And with a lawyer, many people can overcome barriers to healthcare. So the first one case I can share, the first is from our mental health advocacy program for kids that I mentioned. So this was a story that was actually we highlighted in a recent newsletter of ours. And so we represented the parents of a 4-year-old girl who goes to preschool. And there were some disruptions in her routine at school that this little girl had trouble coping with. Her teacher left abruptly. Her classroom got moved, and it impacted her behavior. And she had some difficulty communicating her emotions. And being an English language learner made it even harder for her. And when this little girl, this 4-year-old, gets overwhelmed, she can get kind of physical with other people. So one day something disappointed her. She couldn't be the line leader, and she pushed another student. The crisis team at the school was called in, and the parents were called to pick her up. And when the dad came, she was surrounded by a group of like 5 adults yelling at her. And the dad was horrified. So after, as you'd imagine, after that, calls from the school, they became routine, and her parents were picking her up multiple times a week. The little girl's mom tried advocating with the school to provide some services that could address these very clear emotional challenges that the 4-year-old was having. But the school did not provide any services whatsoever, any support services. And eventually, another incident led to the little girl being removed from the school for 3 days. She was suspended. A 4-year-old girl was suspended. So that's when we got involved. Our lawyer made sure that going forward, when a behavior problem occurred, the school would determine if it was related to her emotional disability, which she had. After that, the little girl was never removed from school and could go to school just like she wanted. And we reviewed the girl's special education evaluations, and we made sure that the right support services were provided. And eventually, we supported the family in transitioning to a new school in their school district that had the full array of services for this little girl that she needed to thrive, which she's doing now, which is a great story.
So, in addition to representing individual clients who come to you and they meet your qualifications, HLA also gets involved in policy advocacy as well. Can you talk about that part of your work and how you decide what to take on and not take on, and what are some of the key issues that you've participated in?
Absolutely. So on top of our bread and butter, if you will, which is representing individual clients, an important part of our mission is advocating for healthcare reforms that help residents and our state generally. And we've achieved reforms throughout our history through both litigation, but also by working directly with policymakers, which is what you asked about here. And the issues that we tackle through policy advocacy are issues that we recognize through representing clients day in and day out are systemic barriers that necessitate a policy change. And most of our policy advocacy involves improving the nitty-gritty of public policy, the regulations and other policies and practices in the weeds that really affect access to healthcare as much or sometimes even more than statutes themselves, and are also easier to change. As you'd imagine, since we represent, like I said, 1,500 people a year, we have a lot of thoughts about the problems that are in the system and how rules and regulations governing the system can be improved. And we share those with policymakers. And we typically do that as part of coalitions made up of several organizations or sometimes dozens of organizations that we share goals with. We engage with Mass Health, the Health Connector, the AG's office, sometimes the Division of Insurance and other agencies, mostly on the state level. And to their credit, policymakers in our state are very accessible. They listen to the problems our clients are experiencing, And it's led to some really important wins that we've had.
So there's individual clients representing them, there's policy advocacy, there's also the arena of class action lawsuits. And I recall when I was running Healthcare for All, HLA was involved in a major class action lawsuit against Mass Health in Massachusetts and the federal government around children's ability to get adequate oral health care through the Mass Health program. I remember very well you won that lawsuit against the state, HLA against the state, and we were one of the lead defendants or the lead plaintiffs. I'm sorry. So 20 years later, what's left of that? Did it work? Did it have an impact? And how do you look at what was achieved out of that significant action back then?
Yeah, that was a long time ago, but it was a very, very important case that achieved a real lot to improve access to dental care for kids. That is really still being felt today, I believe. And it also illustrates what can be accomplished through legal action, when the political process doesn't protect access to healthcare. So the class action you're referring to was called Healthcare for All versus Romney, because Healthcare for All, as you said, was a plaintiff in the case, along with a whole class of children who are enrolled in Mass Health. And we filed the case in the year 2000. And we did it in partnership with Greater Boston Legal Services and a partner private law firm called Stern Shapiro, Weisberg, and Garin. And again, it was on behalf of Healthcare for All and the hundreds of thousands of children who were enrolled in Mass Health and couldn't access dental care, mainly because the state wasn't making sure that there were enough pediatric dentists who accepted Mass Health. So that case took 5 years to litigate. So those class actions can take a very long time, but they can be worth it because they can have a huge impact. So in 2005, a federal court judge ruled in our favor, and the federal court judge ruled in our favor because we presented overwhelming evidence that the state had violated federal Medicaid law by denying access to dental services for kids, which they're entitled to access under federal Medicaid law. And what happened was the court ordered our team and the state to agree on a strategy to improve the system, and that's what we did. So the strategies we agreed upon were the creation of new policies that made it a lot easier for dentists to accept Mass Health. That was key. Mass Health also, for the first time, hired a third-party administrator to oversee the whole program, which it still does today. And the court also appointed an independent monitor to make sure that the reforms that the case required were successfully implemented. And the monitor was to continue reporting back to the judge. So the monitor, who was Dr. Catherine Hayes, a fantastic leader in oral health equity, still to this day, she served as the court monitor for 5 years, as the court maintained oversight over the case. And she made sure that Mass Health actually improved access to the extent required by federal law and beyond. And by the time the court ended its formal oversight, the number of children receiving regular dental care had increased dramatically. The policies that the lawsuit forced to adopt are still in place, and many, many more kids are still receiving dental care than they otherwise would have. The system isn't perfect, obviously to this day, but I think that case that we handled did make really lasting change in the system.
That was an important public health gain, to say the least. Any recent class action suits or current ones that HLA is involved with?
So in recent years, we've been focusing our litigation resources more on representing individuals in court, and also in heavy-duty administrative litigation before Mass Health Board of Hearings, appeals of those matters to Superior Court, other matters in the trial court, and the Bureau of Special Education appeals. And we've been very successful helping individuals and families that way. And those matters can also create systemic reform. We have not brought a certified class action case recently, but with recent federal policy developments so dramatically increasing barriers to healthcare, we are absolutely actively considering all avenues to protect all of the many people who are at increasing risk of losing access to the healthcare that they need.
Has HLA been copied around the country? Are there any other parallel type law firms in other states that you're aware of?
So there are some. There are typically organizations that represent clients with public benefits issues, which we also cover, but nonprofit law firms that focus exclusively on access to healthcare. There are a few. There is one in Chicago that I'm aware of. There is one in Washington, and there is one in Pennsylvania. So there's a smattering of them that replicate what HLA is doing.
One of your big areas that you've been involved in for a good number of years now is issues around children's mental health care and coverage and so forth. Can you talk about that? You're part of a large coalition that came together about 20 years ago on that.
Yeah, access to children's mental health care has been a priority of ours for at least 20 years. In fact, I mentioned before, our mental health advocacy program for kids, it's our largest program, and it's known as MAP for kids. So let me talk a little bit about how we represent families with kids who are struggling to access mental health care, and then I can pick up on the children's mental health campaign, which you referenced. So we created MAP for Kids over a decade ago to address the enormous and very well documented difficulties families have accessing mental health services for kids. And today, just in that program, we have 17 lawyers who are based in family resource centers all across the state, from Pittsfield to Hyannis and in cities in between. And all of those HLA lawyers, all 17 of them, are dedicated exclusively to representing parents and guardians who aren't able to access the mental health services that their kids need. And they do a lot of special education advocacy. That's a big specialty area of ours. And we secure school-based mental health services. They represent families seeking services through their insurance and from state agencies. And they also work to disentangle kids from the juvenile justice system, where a lot of kids with untreated mental illness end up. And we protect kids from getting kicked out of school for behavior, as I mentioned in the case example before. And when that's simply a byproduct of not receiving the mental health care that kids are entitled to. And this program, I want to say, so this program achieves tremendous results for families and is extremely cost effective, which I know is especially important in this day and age. So researchers from the Boston University School of Public Health have studied MAP for Kids for 10 years. And from the data that they've collected from hundreds of our clients, they found that in the families we serve, children and their parents and guardians, they have measurable, significantly improved mental health. There's significantly less family conflict. Kids exhibit significantly more pro-social behavior, and families' ability to earn income even improves significantly because it becomes easier for parents to hold down employment once we're able to get kids into mental health services they need. That was measurable. At the same time, there's cost savings. So the researchers from BU, they found that after we represented families, their kids required far fewer emergency department visits, far fewer hospitalizations and residential services, less involvement in the juvenile court, all of which are really expensive and oftentimes paid for with public dollars, because the vast majority of kids we represent are enrolled in Mass Health. So we're keeping kids healthier, keeping them in school and out of courthouses and detention, and helping their families earn more and saving money in the healthcare system. So we're really, really proud of that work. In addition to MAP for Kids, we also improve access to mental health care for kids as an executive committee member of the Children's Mental Health Campaign, which is a terrific coalition of advocacy organizations led by the Mass Society for the Prevention of Cruelty to Children. And the Children's Mental Health Campaign, or the campaign as it's known, advocates for policies that improve access to mental health care for kids. And our experience representing so many families really contributes to the campaign's understanding of what legislative and other policy reforms are needed, as does the experience of other organizations like the Parent Professional Advocacy League and the Mass Association for Mental Health and Healthcare for All and Boston Children's Hospital, who are all part of the campaign and all work extensively with kids and bring that experience to the policy work that the campaign does.
Matt, as you know, healthcare is incredibly expensive, and all around the nation, there's challenges around medical debt, even in our state with the lowest uninsured rate in the country. But our growing even rate of people with insurance have much more cost sharing associated with it. I know the medical debt issue has been one that HLA has taken on. What can you tell us about that specifically?
Yes, so protecting consumers from medical debt is also a top priority for us. It's a huge problem, as you said, in our state and nationally. And CHIA, our State Center for Health Information and Analysis, found that nearly 1 in 5 middle-income Massachusetts residents is struggling with medical debt. So this is very widespread, and we've represented literally thousands of people who've come to us in a financial crisis because of medical debt, simply because they got sick or needed medical care and needed medical care for some reason. Just last year, actually, we began receiving really generous support from the Atreus Health Equity Foundation, and it allowed us to dramatically expand our work on medical debt. And we have a 3-part strategy in that work. So the first part of it is we've doubled the number of people with medical debt that we're able to represent here at HLA. And we started representing people in court who'd been sued over medical bills. And in some instances for bills they should absolutely never have received, let alone being sued over. Secondly, we're increasing the ability of community-based organizations to help people avoid and address medical debt. Other organizations that aren't necessarily legal aid organizations, but strong community-based organizations. And this is really important because many medical debt issues for residents can be navigated with the help of a non-attorney. And there are very few places that people can go in our state for help with medical debt. So we're doing regular trainings for these organizations and mentoring them on cases that they're handling, primarily located in gateway cities in eastern Massachusetts. And we think in the long run that this strategy can have a big impact. And third, we are tracking a lot of data. We keep data really closely from the cases that we handle, from our clients with medical debt, and it tells us a lot about what the causes of medical debt are, who it impacts. And we're sharing that data with Healthcare for All, who's heading up a really strong effort to develop policy reform proposals that are meant to alleviate the problem of medical debt and the impact that it has on people on an even larger scale. So I'm really happy we're doing this work. We're grateful to the Atreus Foundation for strengthening it so much. But unfortunately, it's going to become even more important, as you said, because again, federal policy changes are likely to cause, tens of thousands or more, hundreds of thousands of people in our state to lose their health insurance, and they're going to accumulate medical debt as a result.
So, final question, Matt, and I want to look at the federal government and the so-called One Big Beautiful Bill Act, or HR1, whichever term you prefer, and the significant bad changes that are coming to the state in terms of people losing coverage, particularly immigrants. 25,000 immigrants who are here legally residing are going to be kicked off Mass Health and the connector. What's your role? Do you have a role in this, in the HR1 issue generally, and perhaps more particularly with the issues around the loss of immigrant coverage that we see coming?
Yes, definitely. And HR1, the reconciliation bill that was signed on the federal level last summer, is just devastating, and it is going to have a tremendous impact on access to healthcare in our state for really probably everybody, but hundreds of thousands of people because of loss of health insurance coverage. We are working really hard to mitigate that damage as best we can. And really the very first group that is impacted by that bill very significantly, as you referenced, John, are immigrants who are here, who are lawfully present in Massachusetts. And altogether, over the next year or so, it's going to result in the loss of federal financial support for 70,000 lawfully present immigrants, including more than 30,000 who are going to have their coverage terminated by the state due to the loss of federal funding on January 1st. So we're talking 6 or 7 weeks from now. More than 30,000 people losing their insurance. These are many folks who have a green card, are here in temporary protected status, and are in the lowest income range of all, under the poverty level. And so this is all as a result of federal funding being taken away. And as of now, the state's plan is to terminate their coverage because of the federal funding that's being lost. But we think, we've been talking about this publicly, that the state should fill the gap in this instance being left by the federal government. And I want to say a little bit about that. Policymakers in our state for years have allocated a lot of funding for health insurance, and that has served our state very, very well. And we're grateful for it. And we also know that the state isn't going to be able to realistically replace all of the federal funding that the state is losing. But we believe that there is a strong case that we should replace this particular funding to continue coverage for these 37,000 residents who are losing coverage just weeks from now. So I'm going to give you 3 key reasons why we should do this, and 1 bonus reason. So first reason is that if these residents have their coverage terminated, the cost of healthcare for hundreds of thousands of other Massachusetts residents who get coverage through the connector is going to go up, even more than the huge increases we've been hearing about every day in the news and people have been reading about every day in their mail. So again, by not acting to cover this group, the cost of coverage will go up for hundreds of thousands of others.
That's because these are healthier on average, is what I've heard, and therefore, if they leave the pool, those who are left are less healthy, and that just raises the premiums, as you've noted. Yeah.
Exactly right. A younger and healthy population. So second of all, if we don't cover this group of 37 or so thousand people, it's going to hurt access across the entire healthcare system. So emergency departments and community health centers, which do a great job, but are already overwhelmed with patients, they'll have tens of more thousands of people seeking healthcare, because that's where people end up when they lose their coverage. So anyone who needs to use the ED, or the million people who receive care at a community health center in our state every year, they're going to be impacted if we don't have continued coverage for this group of 37,000 residents. And third, leaving this population uninsured, it's going to hurt hospital and health center finances at a time when that's the last thing that they need. And they're already in a very precarious financial situation. When low-income people lose their insurance, they revert to the state's health safety net program, which is supposed to provide some reimbursement for basic services. But the HSN is already very financially unstable, hundreds of thousands of dollars in the hole, despite very important efforts by the legislature to support it. And this will further harm hospitals and health center finances as a result when more and more people are relying on it. And the bonus reason we should invest in coverage for this population, and it's really the most important reason, if people lose coverage, some will absolutely lose their lives. There's no way around it. And many will become much sicker than they otherwise would have, because they will not be able to access the healthcare that they need.
On that serious note, and with that dedication towards serious issues that HLA has taken on over the years, Matt, we appreciate your joining John and I today. And we look forward to joining our audience again next month for another edition of Health or Consequences.